This session is getting into sort of the final stretch of this conference, where we begin to kind of look forward and look more kind of generically at issues. I think we always had this agenda in mind in organizing this conference, that this was not a one-shot deal, but it was a continuum. And we therefore, and so we had a past, we have this conference, and then we want to move forward. And so we want to begin to think about research priorities and action priorities moving forward. So sessions 6 and 7 are responding to those questions. So this forthcoming session, Political Determinants of Health Inequities in Global Governance, Conceptual Exploration, is therefore intended to be sort of more forward-looking in terms of some research priorities moving forward in this broader area of global governance for health and political determinants of health inequities. So they will not necessarily be so focused on issues that might be obstacles to universal health coverage. So next we have Suerie Moon, who is from the Geneva Institute, and she was also very central to the original Lancet University of Oslo Global Commission.
Do I need a stool? Maybe. Yes. Oh, thank you. Okay. Oh yeah, wow. Thank you. First, thank you so much to the organizers for the invitation and opportunity to be here. It's not only exciting to meet and see so many people with shared interests, but also to have a reunion among many of us who worked together years ago. So I wanted to do something quite conceptual, which I don't always have the opportunity to do. So I also want to thank you for the chance. And I wanted to delve a little bit deeper into this concept of power and how it relates to global governance for health. And what I'll do is discuss a little bit the concept, offer you a typology, talk about the way different forms of power interact with each other to produce some of the outcomes that we've been seeing, and then close with a few conclusions. So to start, we were reminded yesterday about the WHO Commission on the Social Determinants of Health, one of whose main conclusions and recommendations was to tackle the inequitable distribution of power, money, and resources. And I remember, in fact, when we started working on this commission's report, that we wrestled with that. And two questions that came up that I think we haven't yet, in fact, managed to answer is, what is the current distribution? Because power is, of course, something intangible, difficult to see and measure. And how do you actually redistribute it? Because if we knew how to redistribute it, maybe that's something that we would have done a long time ago. So maybe it's not so simple, in fact, to address this inequitable distribution. How do we think about it in a more nuanced way? So when I look back at what the University of Oslo Commission, Lancet University of Oslo Commission on Global Governance for Health concluded, you can see that it was, not surprisingly, very, very interested in power. And I did a quick count. The number of times power shows up in the commission report, and it's 83. The report isn't that long, actually, 38 pages. So, of course, as you also heard in Sakiko's opening remarks, there is a concern in the report with power disparities, with asymmetries, with imbalances. But again, this question comes up, how do you actually address imbalances, asymmetries, and disparities? And I think we tend to fall back on some mental shortcuts in terms of the distribution of power. And some of those mental shortcuts are, of course, disparities between the North and South, between richer and poorer, between states and citizens, between industry and civil society. But I think many of you in this room are very aware that these mental shortcuts oftentimes miss important complexities of what happens in the real world. And what I want to do is challenge us all to think a little bit more about some of those complexities and how do we analyze them to be able to then take some action on redistribution. So first, a few words about what does the term power mean, and we have some, first a few reflections actually on the need to take a closer look at power. There's a very, I think, influential editorial that Jeremy Schiffman published in 2014, where he argues for a critical need to investigate how epistemic and normative power get exercised in the global health field. And one of the many responses to that editorial was written by Kelly Lee, where she argued that global health is shot through with power relationships and it takes many forms. And I think I'm probably preaching to the crowd here in reminding you of these things. So now, I want to turn to some definitions and concepts of power. The classic one is from Dahl from 1961, which is the concept of power over, right? A has the power over B to do something that B doesn't want to do. And that's a pretty classic one. But I think our thinking on power has evolved since then. And a useful framework, I think, was put forward by Barnett and Duval in 2005 in their book on power in global governance, where they talk about power as the production in and through social relations of effects that shape the capacity of actors to determine their circumstances and fate. And the key argument they make is that scholars have to work with multiple conceptions of power if we're really to improve our understanding of international politics. We also have, coming from the field of public health, Hannefeld and Walt, in one of their responses also to the Schiffman editorial, argued for applying Pierre Bourdieu's 4 types of capital, which I would change the word capital into power, and you can see there's not a huge conceptual distinction: cultural power or capital, economic power, capital, social and symbolic capital. And I won't go into the details of this, but just to start to begin populating your mind with some ideas of how might we think about power in its different forms. Sriram et al., just in an article earlier this year published in Health Policy and Planning, did a terrific overview of the concept of power in global health and reminded us this important distinction between power over and power to, and also reminded us, I think, of this perennial debate we have in the social sciences between structure and agency. How much are we constrained by the structures within which we live? How much power do we have to act, even though we have, of course, a number of constraints that act on us, certainly in the short term? So with all of that as background, what I want to do is to present and argue for at least 7 types of power that I think are very relevant in the way global governance works and in the way global health governance works today. And this is comes out of looking at case studies. This framework was developed based on looking at a number of case studies in years of teaching on this course and interacting with my students, and has most recently been written up in a book chapter. So what are these 7 different types of power? I think all of you, even though the words might not be familiar to everyone, I think all of you, as I go through the examples, will intuitively understand what these forms of power are. So that's what I'd like to do. First, you have an example of, physical power, this is a hospital that was bombed in Yemen a few years ago, and of course this trend continues to happen. So what is physical power? It's often the kind of power that militaries, of course, have, mercenaries, peacekeeping forces, etc., police forces, and power to physically compel an actor to do something, perhaps that they don't want to do. Economic power, this man's name has come up a number of times in this conference, and I think probably I don't need to say much more than that. Structural power. So there's a very interesting case just a few years ago where the South African government decided to not renew, essentially to withdraw from the global investment regime, to not renew a series of bilateral investment treaties. And this was a big surprise, but it's not the only government that has done so. And I think this is an interesting reminder that at the end of the day, the way that our global system is structured, countries, sovereign states do have the ability to withdraw from international arrangements that don't fit their needs. And this is not to say that, again, this can solve every problem, but I do think sometimes we forget that there are ways that governments can, in fact, behave in the global system, they can take actions that might not be what everybody else does, but there are forms of power that governments have by virtue of the way the global system is structured. And this was a decision taken not by the Ministry of Health, of course, in South Africa, but actually by the Department of Trade and Industry, because there was a national debate and a determination that those investment treaties were in fact constraining policy space too much, and that it wasn't worth the investments that they were getting as a result. Institutional power, in this case, refers to rules and decision-making procedures. So many of you are familiar with the fact that for the first time last year, the WHO Director General was elected on a one country, one vote system through an election rather than through negotiations between a handful of countries, which is more or less how the DG had been chosen in previous years. And so, of course, once you change the rules of the game for how elections are run, that also changes who has power to shape who gets elected in this case. And this is a clear example of institutional power, the power that comes with institutional rules. Fifth is normative power, and many of you here in Norway and elsewhere, of course, will recognize Malala Yousafzai, who was named a Nobel Peace Prize laureate just a few years ago. And I think Nobel Peace Prize laureates are, in fact, a great example of individuals who often wield a great amount of normative power and whose normative power is amplified very significantly once they receive the Nobel Peace Prize. One of my colleagues was reminding me the other day that Norway and China actually had a break in diplomatic relations after Liu Xiaobo was named the laureate a few years ago. I don't remember how many years ago it was, quite recently. And I think this is very much a reminder, again, of how normative power of individuals or organizations can be amplified, magnified, or even redistributed in some way. Discursive power. I often use this in reference to how an issue is understood, how an issue is framed. And it's quite interesting that today the opioid overdose crisis in the United States is framed usually as a public health emergency. It was declared by the president to be a public health emergency last year, whereas if we look back into the 80s and 90s, the last time we had a major public health crisis with drug overdoses was with crack cocaine, and the crack cocaine epidemic was in fact not framed as a public health issue at all. It was framed as an issue of crime and amorality, and the response was incarceration. And so, of course, who has the power to frame is an important question, but I do think that discursive power is incredibly important, and one that many sociologists certainly have highlighted. Finally, let me just see who heard about this study when it was published a few months ago. Many of you probably heard about it, maybe not directly in The Lancet. So this was a study that spawned headlines in newspapers around the world saying there's no safe level of alcohol consumption. I see more heads nodding now. So this was a study published in The Lancet, and it's also interesting to see, of course, how many times The Lancet has been referenced during the last 2 days. By Dr. Gakidu and the team at the University of Washington doing a study. In any case, I won't go into the methods of the study, but the point I'd like to make here is that, of course, expertise in terms of establishing what is true or factually correct is also a source of power, or a type of power that can be very influential in public health. Now, all 7 of these types of power can be positive or negative for health, but I think when we're trying to understand and analyze power disparities, it helps to start to pick apart, open that black box, and pick apart this concept a little bit. If I could summarize my overall point, does anyone recognize anyone in this picture? Does anyone recognize the woman in this picture? So many of you recognize the man as being one of the most powerful people in the world, for better or for worse. But you may not recognize the woman. This is Maggie Haberman. She's a journalist for the New York Times. And despite everything that Trump says about fake news and not trusting the media, apparently he reads the New York Times religiously and is very influenced and in fact hurt by what the New York Times says. And it's in particular this reporter's writing that drives him crazy. And I'm sure many of you have read her article. She's a terrific reporter. But this is, again, to highlight even the most powerful person in the world, of course, is influenced by other forms of power, sometimes coming from individuals whose names and whose faces might not be as globally recognizable. So I just summarize here these seven categories. And I wanted to then make a couple observations about where I think we are today in the study of power in the field of global health. So certainly I think if we think about the study of power as having gone through a stage 1.0, recognizing the importance of power, the importance of politics, that has been, I think, one of the important lasting contributions of the Commission's report, and of course, part of the shared interests that bring together this group of individuals. How do we move then to a 2.0, where we better identify the types of power that operate, the magnitude of power of different actors? Who are, in fact, all of the different actors who possess power to influence and shape global governance processes and outcomes? And I think many of the presentations we've heard over the last couple of days, of course, do this, even if they don't necessarily use the same words. I think where we need to go, and where I've not yet seen enough progress intellectually, and this is just my personal view of the field, is in understanding the interaction. How do different actors with different power at their resources at their disposal, how do they interact? How is one type of power fungible with another? How is power amplified? I mean, the example I gave of the Nobel Peace Prize, I think, is one where power can be amplified, hopefully for peaceful and positive ends. Are these parts of the answer to the question of how power can become redistributed? And this is really where I think further research needs to focus in the future. So just a couple of mental models. What do we already know from the literature? This is Paul Sabatier's Advocacy Coalition Frameworks, and it's a very useful mental model, I think, because it's relatively simple, right? And the argument is that you have two sides who are fighting over a particular policy, and what happens, how do we actually change policy? It's when one side gets a bit more power than the other, and there are lots of ways that can happen, but it's the idea of a seesaw, in a way. I won't spend too much time with that. I think it's a very useful mental model for teaching and for analysis, but what if our mental model of how the global health system looks and works is a little bit more like this? What if it's more of a complex system with many, many more actors, lots of different kinds of power interacting at the same time at multiple levels, across scales, across time? Then how do we think about the way power interacts? Once we think about the global health system as a complex adaptive system, it becomes much more difficult to begin to analyze both the distribution of power and how one might redistribute it. I'm going to skip this slide. What I want to focus on is not so much the description of complex, oops, that's my own alarm. So I'm going to wrap up. I don't want to focus so much on what complex adaptive systems are, but actually what are the implications of thinking about the global health system and the broader global system outside the health sector as a complex adaptive system. What does it imply for action? I think the first is that small changes can have unexpected big effects, whether positive or negative. That you can take focused action in one area, and that won't be enough to change the entire system, but therefore it's important to build networks, and I think conferences like this are an extremely important opportunity to build networks. That complex adaptive systems tend to get locked into certain patterns or certain trajectories. It's important to recognize that and focus on how do we move out of a situation of lock-in. And finally, the complex adaptive systems also reach tipping points where they move from one trajectory to another, or they tip into a different form. And so how do we continue to aggregate small changes and victories in different issue areas to reach a tipping point? I want to end by referring to another Nobel laureate whose work was recognized in 2009 precisely for arguing for this kind of thinking about social systems and social challenges. So to conclude, I have just 4 conclusions. I think the first is that it's important not only to give attention to power, but to work collectively towards improving our understanding of the way power works. It's important to recognize the different forms of power that are at play and the different actors who wield it, including those who are traditionally thought of as weak. It's important to recognize the interaction of power and how complex that is, but I think it's not an insurmountable intellectual challenge. And then my last conclusion is really, I hope, an optimistic message, which is that, of course, power disparities are serious. I don't mean to minimize the very significant power disparities that we see all over the world today, but they're not absolute and they're not immutable. So I really welcome any comments. This is still, in many ways, work in progress. Thanks very much.
Difficult to pronounce. Kentikelenis from Bocconi University.
Great. Well, thank you very much to the organizers for having me and for putting me on this really exciting panel towards the end of the conference. So a lot has been said already. And my own presentation here is primarily, of course, on the conceptual element. And the paper, the underlying paper is called Power, Symmetries in Global Governance for Health, a multi-level framework of analysis. So before I get to that, I cut my own teeth academically by studying the effects of austerity in Europe in particular, and then in the developing world. So here you see what was known just a few years ago as a troika, the institutions that imposed essentially austerity and structural adjustment in Southern Europe and Ireland. And you see Jean-Claude Juncker, who looks much younger, even though this is just 5 years ago. So I did these kind of empirical studies, which I will not discuss, and most of my presentation is really on the conceptual side, and follows very much on where Suri ended almost, where with the increasing complexity and multipolarity in global governance for health, which can often obscure how power manifests and how these power asymmetries entrench health inequities. So the Lancet University of Oslo Commission, I think, did a really great work and a service to the profession by focusing our attention on all of the governance areas that affect health. And it included an analysis of the multiple actors involved in a range of policy areas and the political determinants of health inequities. And it included a discussion of how Greece was affected, which I'm Greek, so I particularly appreciated that analysis, given more visibility to what happened in Greece. But I want to shift gears a little bit and look at some theories or some ways of approaching power asymmetries in global governance for health. And I propose 3 building blocks that will hopefully enable me to build an analytical framework. First, I start with the concept of institutions. Of course, social scientists have written a lot about this. Institutions as chronically reproducing complexes of rules, routines, roles, and meanings. And they have, of course, many dimensions, including regulative dimensions, normative dimensions, and cognitive dimensions as well. Institutions include a wide range of concepts, essentially, from the nation state to the corporation, to the international system, to global norms. And these institutions are replete with power asymmetries. They're biased towards maintaining the status quo, itself part of past power struggles. So that's the first theoretical building block, which is often known as the macro level of analysis. And to that, we add the so-called meso level of analysis, the organizational level, which is another key locus where power asymmetries manifest. This meso level is inhabited essentially by organizations that themselves operate within specific institutional constraints. Here, the range of organizations that are involved can be from ministries of health or ministries of finance to the WHO and the World Bank and the Gates Foundation and so on. So this is what most of the analysis we've been hearing in this conference and in the literature are about. And of course, there is a micro level of the individuals who inhabit institutions. So of course, individuals, the more banal way of phrasing it is that they all have different amounts of resources, economic, social, and political resources. But we shouldn't understand individuals as free-floating, all-powerful actors. We should understand them as being embedded within specific institutional structures, and they enact essentially norms that are propagated by the dominant institutional structures that are imprinted on them through socialization, whether at home or through educational systems. So individuals act according to specific cultural frames, and we see that both in what ordinary people do, the kind of choices they make, but of course in terms of policy elites as well. And I will return to this in a second. So these are the three main building blocks that I'll use, and I'll bring in three conceptual units. The first is, of course, power and power asymmetries. And of course, Suri discussed this quite a lot. And here I basically take the three lenses that sociologist called Stephen Lukes advanced several decades ago, that we need to be aware of three terrains of power. So we need to understand decisions, where A has the power to influence the decision of B, which was the Dahl definition, essentially, of power. We also need to focus on non-decisions. That is also a terrain where power asymmetries manifest. And then we need to look at a third dimension of power, this institutional setting that sets the broad parameters, defining which topics can even be subject to decision-making or non-decision-making. So adding to this, the second concept is that of health inequities, or health inequity, which in our framing, we understand it as a systemic feature of the contemporary world. That is, health inequity is not merely an unfortunate and unintended consequence of otherwise well-meaning policies. It is a core element of a system of extraction and rent expropriation that is geared towards maximizing private profits and for the allowing redistribution only for the purposes of social amelioration, like targeted social assistance, and we can discuss that later on. So Greece, for example, is perhaps disturbingly a social laboratory for how far populations can be pushed with skyrocketing health inequities since the onset of the crisis, but we can return to that later. The third concept, which is quite crucial in this framework, and which the Lancet report only refers to a few times, I think I did the search in the documents probably 4 times, it's the concept of neoliberalism and its global dimension. So what essentially I propose here is expanding a little bit from political determinants to political economic determinants and bringing neoliberalism back in. What is this? It's an intellectual, bureaucratic, and political paradigm that advances free markets and individual rights as organizing principles of collective life. So on the intellectual front, it focuses on not just having a market economy, but instituting a market society. And here you see a racially and gender and sexual orientation-wise diverse group of people who really pioneered this line of thinking. I won't name all of them, but they did so in a range of books. Milton Friedman and Friedrich Hayek are perhaps the most popular versions, and yesterday somebody mentioned the focus on choice, and here you see, the work by Milton and Rose Friedman on being free to choose. So it has these intellectual dimensions, which of course travel into time. Here you see Larry Summers, who has had too many hats to list, who almost 2 decades ago said, the laws of economics, it's often forgotten, are like the laws of engineering. One set of laws works everywhere: privatization, deregulation, stabilization, liberalization. You can't make this up. But anyway, that is what Larry Summers said. So these are the ideological manifestations. And of course, there are bureaucratic manifestations, organizations who inhabit and propagate this way of thinking. Here, just from, this is a nice picture from Vogue magazine. It's Christine Lagarde, the head of the IMF, who a few years ago mentioned structural adjustment. That was before my time. I have no idea what it is. We don't do that anymore. Of course, this goes back to the points that were raised earlier, that austerity has been normalized. Structural adjustment is the way of being. So, you know, for Christine Lagarde, and I believe that it was genuinely a term devoid of meaning to her, but that's because the meaning has been perverted. And of course, there are political manifestations, and here you just see Paulo Guedes, who will be the this is a true title, Super Ministry of the Economy, Trade, Industry, and various other things. Here you see him with Bolsonaro, who mentioned that we will reduce public debt by 20% through privatizations and spending cuts. So that's what's in store for Brazil. And thinking of Rosalind from OSF, I came across this quote the other day, which I thought the OSF people would like. Guedes said, order, what an open society needs is order. So this focus on basically order as a key component of neoliberalism, and what they understand is essentially a punishment, an order that basically punishes anyone who's not willing to play according to that rule book, and we can discuss this later on. Okay, so I'm running out of time, surprisingly, so I'll go a bit faster. So what we propose here is essentially a multi-level framework of analysis, where we try to bring in neoliberalism into thinking through how health inequities are perpetuated. And I'll go very fast, partly because populating this framework can easily be done with what we've been hearing about in the last 2 days. So I propose different channels through which the global version of neoliberalism impacts health equity. One goes through the micro level. So neoliberal frames are internalized by individuals, and then these are reflected in their values, their interests, and their choices. So these ideas or values are important because these are the tools that people use to make sense of the world and their place in it. For example, there's work by an ethnographer in Massachusetts called Ofer Sharon, and it's on unemployment, and it's called Why Americans Blame Themselves and Israelis Blame the System. So, you know, these ideas are important about how we understand our place in society, whether we are responsible for our own unemployment and so on, which of course has manifestations in physical and mental health. And neoliberalism, of course, affects the choices people have in terms of lifestyle, nutrition, health, and so on. And there are 2 dimensions here. There is, of course, the dimension of choices for ordinary people, and for example, there are political choices, what to vote for, whether to vote for parties that are promising austerity, and elites' choices in different policy settings. The second dimension that I bring in is this meso-level dimension, where neoliberalism affects the kind of actors involved, the forms of decision-making, and the content of policy choices. So in terms of types of actors, whether these are global or national actors, whether these are public, private, or non-profit actors, or hybrid actors, so neoliberalism affects the legitimate mix of these kinds of factors. Of course, it is associated with several forms of decision-making. This could be hierarchical decision-making within organizations. It could be market-based decision-making within the private sector. It could be ecological decision-making, bringing together a range of disparate actors, and we can discuss that later on as well. And of course, it affects most obviously the content of policies. And here we go back to the Summers quote on deregulation, privatization, liberalization. For example, trade agreements, as we heard yesterday, block government's ability to regulate health hazards, or the content of policy choices vis-a-vis dismantling welfare states in Europe and elsewhere, or corporations, again, as we heard yesterday, using their resources to bankroll NGOs and advance false or biased information. And to this, and that's the final point, we add another link between global neoliberalism and health equity, and that is the macro-macro link. That is the area of frames, scripts, and models that circulate transnationally. What do these frames do? They legitimate and construct economic activities. They legitimate the international order and nation states within it. They structure collective action, and they legitimate different types of scientific knowledge. For example, that private sector companies have a legitimate role in providing healthcare in developing countries, as we heard earlier, or that intellectual property rights are a legitimate way of restricting scientific advances and privatizing what is often publicly funded advances in knowledge. So what this is really meant to do is to be a framework that empirical studies can plug into and add different empirical analysis of manifestations of neoliberalism and how it affects health equity. So that's the focus on the political economic determinants of health inequity, which is, of course, just a slight tweak to the political determinants proposed by the Lancet Commission. But of course, global neoliberalism may well indeed be the dominant institutional order of today, but it's not the only one. And there are alternative frames out there, including rights-based approaches to health and to policy. So and of course, these rights-based approaches or these alternative approaches very often exist in normative and institutional competition with neoliberalism. So I think what this collective enterprise in this auditorium is about is perhaps thinking of how we can shift from the established order of global neoliberalism to these other more progressive institutional orders. Thank you very much.
Thank you very much. Now, next we have Sidsel Roalkvam, or I can never pronounce these difficult Norwegian names. I apologize. So Sidsel is our boss, who also has a long history with the Global Commission. So the reunion continues.
Okay, thank you. And thank you for inviting me to speak. It's kind of interesting to try to reflect on something that I didn't own while I was doing it. We were writing up other people's deliberations, and it's some of the most difficult work I've ever done. But I'm going to reflect from a different kind of perspective and maybe draw out some things from the local commission that we haven't discussed yet. And it comes from my background as a social anthropologist, and that we start our conceptual thinking in practices as a concept. And social practices, and social practices that takes place in relations. And in these relations, power are exercised. And it's not very difficult, actually. So I will start, as a good anthropologist, always with a story. In August in 2006, the people of Abidjan and Côte d'Ivoire woke up engulfed in a foul smell. Toxic waste had been dumped in at least 18 different places around the city, close to houses, workplaces, schools, and fields of crops. People began to suffer from nausea, headaches, breathing difficulties, abdominal pain, stinging eyes, burning skin. No one knew what the waste was or why it had arrived. It turned out it belonged to the Europe-based oil trading company, Trafigura, and had, under international law, arrived in the country illegally. So the toxic waste was generated by a transnational company that went hunting for places in the world that would accept their methods of refinement and disposal. So they traveled and traveled to redump and reduce costs, from the Mediterranean to the Netherlands to Estonia to Nigeria, and lastly to the Ivory Coast. until it ended up with a contract company that had no experience in dealing with this waste. These ships are still sailing with their toxic waste, looking for harbors to dispose of them. Supertankers and cargo ships are dismantled at the shores of Bangladesh and in India, detrimental for environment and for health. In Norway, we are celebrating the Norwegian oil history at the moment with a drama called Lykkeland, fortunate country because of oil. At the same time, this is a Norwegian environmental bomb outside Benin, when Saga petroleum oil rigs are rusting away. Oil is leaking out and causing great environmental damage in one of the most abundant ocean fishing areas. Benin has asked Norway to help clean up. As of yet, Norway does not feel responsible. These were exactly the issues that we tried to grapple with in the Lancet University Commission. We sought to grapple with what is going on here and what has gone wrong. We learned that the world leaders had signed up to impressive 500 international recognized agreements in the past of all these hazardous substances, but they appeared weak. So this is where we start to think about how power is exercised in relation and how power asymmetries has detrimental effect on people's health. So we came up with this framework with weak institution, power asymmetries between actors, dysfunction in the global institutional architecture. But we started with practices. But another interesting issue, what we really struggled with, and this is maybe where we come to some methodological issues, is that we really kind of struggled with making this fit within a concept of health. How does these environmental, how does the law, how all these things actually fit into a health definition? So it was a taken for granted idea of what health actually was. So we tried to locate this in the social determinants, of course, how people live, work, and die. And we built it up, but still it didn't fit. We tried to trace pathways up and down. How much illness can this ship actually affect on people? When did these kind of evidence be counted like evidence that mattered? How could we use stories as something to reveal how these things mattered? And it was very difficult actually to make this fit in a Lancet publication, stories and practices. I think we need to remember that at that time, when we were struggling with this, we were on the end of the NDG era. Health has been reduced, I must say, to MDG 4 and 5, priorities of women and children, even narrowed down to immunization and facility-based birth. So we worked within a system where we tried to expand what health was all about, at the same time where everybody was narrowing it in. So how could we link toxic waste, disease, and global action? And how could we make it count? I think when we worked on this, we were thinking that it was a really transformative agenda. And I think I'm recalling now when we're going into Sustainable Development Goals. I remember the Commission actively tried to talk into that agenda of the Sustainable Development Goals, thinking that this would expand health into a more grand definition, taking care of the social determinants, really trying to look at how people live their lives. But the policy space keep kind of shrinking and shrinking all the time. And when you work from the bottom up, you kind of see that health choices that people have is indeed more and more limited. policy space for countries are more and more limited. And policies chosen at the global level are getting more and more limited. So the unfettered market and the power asymmetries was really running through. And I think if you look at it as relations, it's not very kind of difficult to see what is happening. We could also see that the weak governance structures needed to be strengthened, but how to strengthen them. Addressing the responsibility for public goods, but how to do that. Highlight the interconnectedness of social, economic, and environmental concerns and its distributed consequences, but how to do it. And how to address the shrinking policy space and choices, health choices that people have. So this is really talking into the sustainable goals. Health could have a place in all these goals, but it has not. Other choices has been made. Whereas the Commission at that time was thinking about health in all policies and think that there could be sort of really guidance for how we could have sustainable lives within all these beautiful goals and the beautiful 2030 agenda. The policy space, as we see it, unfortunately, keeps shrinking. We look back at the deliberation of the African Union and how they put in what they really wanted to happen with the Sustainable Development Goals. We kind of see sort of something of what was trying also to be said in the Commission. They asked for a policy space to pursue what they wanted to do in their societies. They asked for an international environment to be an enabling environment, not a disabling environment. They wanted us to take care of specificities of countries and nations and identities, not making it all like a global, and indeed not set up nations to fail. That was an argument of the MDGs. So when we are moving into this, there's a lot of things at stake here, I think. When we are moving into these, before we even have started this agenda, the 2030 agenda, we are talking about it still. I mean, there's warning signs going out. I mean, the Deputy Secretary General of the United Nations, Amina J. Mohammed, she was here recently, and she keeps saying this all over the place, actually. I looked it up at Google. We must avoid an SDG-light approach, one that pays only lip service to the 2030 agenda's call for transformation. The fact that we should look at all these goals as connected. There is a danger, it is further argued, for cherry-picking individual goals and indicators, conform to business as usual, focus on monitoring, collecting, and reporting on the indicators, and chasing small and measurable wins. And what is the health communities that Richard Horton usually called it the global health community? I don't know who they are, but it is a big group. What is the answer to these challenges of this broad sort of health that is situated in society? Well, it's universal health coverage that can fit in a box. And I'm not very happy with the box, because in this box, I feel that there's business like usual. Again, we are narrowing down what health should be all about. We are again talking about cost effectiveness, priorities of the most sort of lives saved for different kinds of diseases. We do not look into practices, and we do not look into how these health systems actually work. Let's beg the questions: which services are covered and who decides? Cost effect, the principle of cost effectiveness, who decides? The priorities, who decides? What does it leave for the government's ability to promote and protect? And have we forgotten how important the health system is in building sound and good governments and states? So everything, how much? Okay. So it lies, the most of things lie outside the UHC frame. Even if we go on with thinking that we should go with the universal health coverage, and we have heard a lot about this, of the trade agreements, the revenues, everything that actually lies outside the box and is going to impact on the country's ability to deal with them. And I remember Alicia Bacena early on in the commission, or when we started the panel, she said that the panel should really look into procurement. And we have heard procurement discussed vividly to how difficult it is. And I think Annan at that stage listed up all the trade agreements a poor health minister needed to know. And we might even ask if we should help countries, we should give them lawyers, top lawyers, that can deal with big pharma in making these decisions. So you don't always ask for money, you ask for somebody to help you deal with power. So come up on a level playing field. So what kind of knowledge do we need? I think that a lot of things that is going on, and this is important for me, that is why I want us to focus on practices. It is that a lot of the things that we do are actually technologies of distance. And Desmond and I has written about that. What is happening when you shy away from real life and hide yourself behind statistics? Technologies of distance, they kind of take you away from knowledge about context and specificities. In order then to do something about it, we need to study from the ground up. We need to study practices and start there. And this is one of the things that I am very proud with the Commission work, is that we actually tried to start with the practices. And from there, we trace continuities and connections, not necessarily causal chains, but continuities and connections and comparative pictures. And it's running through the whole thing that we need to pay attention to the social and the political. To conclude, and I quote Roalkvam McNeil here, health is more than minimizing risk or deploying technologies. The attention surely has to be redirected towards those who seek health for themselves and their children, and the structures that support or inhibit them in their search. And that could go for governments as well. Thank you.
So we have a little time for our little roundtable discussion. So, Sidsel, sorry, will you? I need to. So I think we have time for a couple of rounds of questions. Yes, I'll take several at once. So, yeah, and Desmond, and James. Yes.
Thank you very much. Absolutely fascinating presentations. And to come to this issue of structural adjustment and its long-lasting impact, if you want a very good case study on its long-lasting impact, you might want to look at the issue of medical detentions in hospitals, particularly in Africa. We did some research last year at Chatham House, showing that the prevalence of high user fees, which were sort of imposed on African countries by the World Bank and the IMF, combined with poor governance, means that thousands of people are locked up in hospitals because they can't pay their healthcare user fees. It's very prevalent in Nigeria, Congo, Cameroon. And you might want to see, just last week actually, a very good piece of investigative journalism done by the Washington Post, well, in fact done by AP, but in the Washington Post, New York Times, showing the scale of this in Congo. They found that 95% of hospitals in Lubumbashi were routinely locking patients up who couldn't pay their fees. And then the relevance to the ongoing complicity in this is that they've actually challenged donors who are supporting these hospitals say, are you aware that these hospitals that you're normally supporting are actually locking people up for months on end? And they actually found out the Global Fund in their contracts with the Congolese government stipulate that medical detentions should only be used as a last resort. So they're fully aware this is going on and turning a blind eye to it. And you know, I think it's, as we challenge ourselves on this, and I think this does ask big questions of a lot of the donors, a lot of NGOs supporting these units as well. How can we be serious about UHC when we're locking people up in hospitals?
Yeah, thank you very much. I'd like to ask a question to Suerie Moon. I liked your sort of classifications of power. I'd like to try and push you further and try and link that to possible, what are the strategies, given that is the situation? That's a very broad question, but if I relate it to, for example, one of the issues which has come up, I think, very strongly here about trade and investment agreements and just the incredible degree of detailed knowledge which is required if you want to try and push back on those. Now, that to me, so I'd think, okay, if that is the issue, what types of power can we mobilize against that, and what sort of combination of social movements, academic, so are we talking about normative power? Are we talking about framing, who's good at challenging the framing, the expertise? So if you could speculate a little bit about the possibility of translating your analysis into a sort of strategic and maybe related to a specific issue.
Go ahead.
Thank you. Just wanted to respond to two of the comments. One on neoliberalism, which I think is really important to try and get people to understand what neoliberalism is and to get them to understand that this is actually a political project. It's not just something that has emerged on its own, but there is a kind of political project behind it. And one of the brilliant things about neoliberalism is that it's been able to kind of give this notion of, what did you say, privatization, deregulation, et cetera, but in actual fact it does the opposite. That in many of the major sectors we don't have free markets, and of course we have huge amounts of regulation. You think about the bailout of the banks as a form of government intervention. And the other aspect of neoliberalism which we perhaps need to think about is its dependence on this myth that we can continue to grow economically. This economic growth model, which is often used as an excuse for the idea that free markets help to lift all boats and redistribution is not important. And I wonder if the climate crisis and the ecological crisis is one opportunity for pushing back on this kind of neoliberal discourse, which I think people struggle to really understand because of the contradictions that are within that ideology. So I wondered if you could comment on that. And to Suri, I wonder if you could say something about the notion of hegemony. That, again, the way in which power operates, there is a kind of hegemonic discourse which causes this kind of self-censorship, this idea about, what is and isn't acceptable and what is and isn't normal, what is and isn't possible. I'm constantly reminded of the importance of Steve Biko going back to South Africa about black consciousness. And he making the point that, yes, there was an apartheid system, but there was also a kind of internal psychological oppression that was self-imposed by many people. And to some extent, that's how I think hegemony works. And, I wondered if you could kind of just comment on that, so in terms of your analysis of power.
Thanks a lot. I have a question similar to the other ones, but wanted to go to ask especially the power theorists if you can give us some kind of advice on where to go. What are the I believe, a little bit cynically, that change is probably not going to happen from people like us in this room. It's going to come from social movements. It's going to come from people mobilizing at grassroots that are going to be pushing people like us in the institutions. And I'm wondering if, especially Alex, I really enjoyed your presentation on neoliberalism, the normalization of it. Where do you see the real points of resistance in the real world right now? Is it the strikers in Arkansas and West Virginia in the United States that are beginning to really challenge American neoliberalism? Is it social movements, the Occupy Nigeria movement, for example, a couple of years ago, which was quite exciting, the pushback against IMF in Nigeria? Where are the places we can look to where there's real resistance developing that is going to be changing the way we think about this as the world moves into a crisis? And I'm wondering, or it's already in crisis, but moves into deeper crisis. And just one final promotional note, in Bangladesh in a couple weeks, there's going to be the People's Health Movement is having its big global conference. And I think there's a few folks in this room that are attending. The group I work for, HAI, is the North American representative of People's Health Movement, which sounds kind of grander than it actually is. But anyway, so keep, that's a form of resistance as well, that there are these counter-hegemonic activities going on. So I'm just wondering what the power theorists would suggest are the places where we can engage and support social movements who are doing active resistance now.
After this morning and this afternoon, I think we're all falling into despair after this dystopic present and future perhaps we are envisioning. But I want to push us, building on the last couple of comments, around different variants of what appears to be missing from the talks around people's power. Right? So the idea of constituent versus constituted power, I think, is absolutely central to this discussion. And rather than continue with the business as usual, pushing the levers of the powerful political players that we've been mentioning over the past few days, what about thinking as creatively as the PEF funders and the PEF fund itself? Where is our creativity in analysis and intervention, and where is our responsibility? We were all complicit as academics, as folks in government, folks who are able to come to a conference like this and enjoy the Oslo opulence, and yet where is our responsibility to the communities we are serving? I get from my civil society activist friends a sense of exhaustion, of precariousness, of far too much emphasis on what they should be doing rather than civil servants, again, scholars, folks with a permanent position, folks in the UN who have rolled over for decades. I mean, I remember working at PAHO in the early 1990s during the health reform, the augur of the Colombian health reform, which was kind of the real world privatization, because you couldn't really use the Chilean model. That was under a dictatorship, so it had to be done under a so-called democratic regime. And what folks at the Pan American Health Organization were saying, well, we're underfunded, and our brothers and sisters at the Inter-American Development Bank, the World Bank, et cetera, need to be our partners. So I think we're all complicit in this sense, and we also need to think much harder about alternatives, maybe unpleasant as some of them appear to be to some quarters. So here I'm thinking of the role of South-South cooperation in its different variants. I mean, we didn't, in the Mozambique case, I was surprised, we didn't hear anything about Brazil's role in establishing a pharmaceutical plant in order to not be subject to international pharma patent price gouging, et cetera, and yet at the same time some of the contradictions of that, such as the massive construction industry, mining industry, Vale, and so on, investing in northern Mozambique and being part of the problem. So then there are and I'll finish up with this, then there are two other variants that I do think we need to consider quite seriously. and one is the barter exchange between Venezuela and Cuba that responded directly, not only to Chavez and Fidel, who were buddies, and Chavez an admirer of Fidel, but rather to years of pent-up frustration on the part of Venezuelan barrio dwellers who were concocting a way to draw down electricity, to service health and educational needs, and pushed and pushed and pushed. And the Chavez regime responded to this pushing. And I think we need to take this far more seriously in our analyses, as well as in our responsibility for thinking of less dystopic future. And just finally, on the point of the climate and planetary future, there are other ideas coming out of the Andes in Latin America. The idea of summa causa, or what's been kind of characterized as buen vivir, living well. So this notion that we don't need to grow, but rather live in harmony and balance with nature. And why are we not proposing the end of the consumer economy, right? Which has, of course, pushed along with the rise of the neoliberal phase of capitalism. Sorry for my rant, I just had to get it out. Thank you.
Yeah, the challenges posed by Anna Manuel in depth. But I'd like to give just a couple of, I think we have a time for a couple of minutes from each of you to respond back to many of the, to any of the comments and questions that were raised by the audience.
Okay, thanks. So I start with the comment by James, and to be provocative, I will strongly disagree with you. So you started off your comment by saying that change is not going to happen by people like us in this room. And to substantiate my disagreement, I will quote Milton Friedman to you. In his introduction to Capitalism and Freedom, his book in 1972, when neoliberalism was still a fringe idea, he, addressing his fellow travelers in the Mont Pelerin Society, he said that our objective, by our meaning the Pelerin Society objective, is to keep these ideas alive until the unthinkable becomes inevitable. And what this group of economists and their fellow travelers among business did was essentially be relentless in diffusing their ideas into policy. And what is very interesting if we look at this first generation of neoliberals is that even though they were all based in elite universities, their students did not go into tenure track jobs in elite universities. They went into policy. They went into the Treasury Department, the World Bank, the IMF, and from there, they really spread this agenda, which, people may happen, change may happen from people like us in this room and hopefully our students. And in terms of points of resistance, I would just invite you to look at the UK of all places, where it seems that Jeremy Corbyn has a non-trivial chance of being elected in the next elections. If you thought the anti-neoliberal revolution would start from Britain and you told me that 5 years ago, I wouldn't really believe you. But so there are promising spots. Then on David's point about the contradictions within the ideology, I think they're very important, and here I draw a lot of inspiration from the work of Pierre Bourdieu, who understands the state as having two arms, the right arm and the left arm. the right arm being the arm of the courts, of the prisons, of the police, and the left arm being the redistributive arm. Neoliberalism is quite good friends with the right arm of the state, and we see that of all places very much in the US and elsewhere, with this explosion of prison populations and prison being a system of poverty management and so on, while essentially gutting out any kind of social provision. So I agree with you that we keep needing to point out both it's a political project and that it's been politically constructed. There is nothing natural about markets. It's only one way of organizing social life. And thanks a lot for the point of medical detentions, which I knew little about, but now we'll go and learn all about it.
Thanks very much. Thanks for a very provocative and thought-provoking, and interesting set of questions and comments. I think I'll try to respond in a unified way, because I think there are some common threads between a number of the questions that were raised. And I think one thing I'd like to say in terms of this notion of people's power is that I think everybody, we're all people, right? And I think this underscores a bit the point that you were making. And it doesn't mean that a certain group of people or subgroup is enough, but presidents and secretary generals and heads of companies are everybody's a person at the end of the day. And so when we talk about how do we aggregate power, going back to, I think, Desmond's challenge, how do we take the different forms of power that different either individuals or groups or subgroups have to try to push for systemic change or policy change? I think that is a fundamental challenge. And it's what Ted was telling me over lunch the other day as we were standing in the buffet line. So how do you get different groups of people to work together? And I think, when I talk to people working on access to medicines, for example, it's always a question of, okay, how can we get the civil society groups together with the academics, together with people in governments who are concerned about this, together with people within the WHO who are concerned about this? How do you, together with people within industry who are concerned about this, how do you build these networks and tap into information and influence that different groups have in different networks? And I think that's part of this notion of aggregating power. I mean, the seesaw picture that I put up is an oversimplification, but I think somehow still useful for thinking about that and the need to pull together different groups. And the aggregation in and of itself, I think, can also amplify and change power dynamics. And I think that the example that Judith Rios gave yesterday around the Trans-Pacific Partnership is one that really has stuck in my mind, because I think many people who worked on the TPP, and she's one of the tireless people who ran around the world convincing government officials how terrible the IP chapter was, and was very successful in doing that. And I think up until the very last moment, people felt, on the access to medicine side, had felt, oh, well, we lost. Because look at the terrible provisions that governments have agreed to at the final negotiation meeting of the TPP. And nobody would have predicted that Trump was going to be elected and that Trump would drop out, but of course, would pull the US out of the TPP. But as soon as that happened, all of Judith's work and other people like Judith paid off. Because suddenly all these governments said, oh, we never liked this chapter, we never wanted this chapter, and now that the US is out, we don't have to accept this chapter. And I'm not saying the TPP is perfect or wonderful or anything, but I think that story is so compelling because it first highlights the unpredictability of many of the systems, social systems that we're looking at. I mean, what you're saying about Corbyn possibly being elected, I don't know. I don't know what's going to happen next week with the midterm elections in the US. Many people did not predict what was going to happen in Brazil last weekend. So there's a certain unpredictability about what happens in the global arena. And that is directly a result of the complexity of the underlying system. So when you have such a complex system, I think doing the work that people did on the TPP, for example, to lay that groundwork to, even when you think you have a hegemonic power that is blocking you from doing what you're trying to do, I think laying that groundwork at the end of the day was very important. Now, of course, now we have the USMCA, we have all of the trade agreements that Tanya was telling us about and that Deb was telling us about. And so it's not as if that's the end of the story, and it's not as if one twist of fate and one important step forward for public health means that everything is done and settled. But I do think looking at that evidence and looking at that experience suggests to me that hegemony can be perceived, but is not necessarily as overwhelming as we might sometimes accept it to be. I might just stop there.
Well, and I think that the incredible thing is that on this TPP story, it was sort of giant against, David against Goliath, right? Because in fact, it was like 5 or 6 of Judiths who ran around the world, and like Sanya. And, I'm sure there are other people in this room who had various parts in it, but maybe Deb, maybe Susan who wrote this book originally, 15 years ago, who planted the seed of idea in everybody's head that gave this basic understanding of what was actually going on. But it was this kind of trigger, if you like, very focused investment of effort by surprisingly few people, that I think made a huge difference. So.
Three points as quickly as I can. First of all, I agree with both David and Alex about the importance of focusing on neoliberalism as an historical project. And as I said, the historical record is there for those who care to read it. But then since Claire Bambra and I published a book a few years ago, the subtitle of which was Neoliberal Epidemics, I would say that. The second point on strategies for change. Any social scientist who tries to predict the trajectory of social change should be regarded with extreme caution, as we know, for example, from the fall of the Soviet bloc. But I would say that a lot of the historical examples we have involve building what Simon Schrader calls cross-class coalitions. And that's why I focused in my talk on circumstances in which building those coalitions appears, and I emphasize appears, improbable, because Niels Bohr was right about prediction. Third, on what the responsibilities of academics and other relatively secure people are. I could go on about that at great length, but I won't. I think the primary responsibility is first, stop lying about the maldistribution of economic power and economic resources. And I think quite bluntly, there is a lot of that going around. So the advocacy coalition framework may be appropriate for policy analyses in some situations, but in others, there is an elephant on one end of the seesaw, and many academics will politely ignore that. Oxfam has a much better track record than the social science profession taken as a whole.
Yeah. Actually, I think that people push back every day. But we need sort of kind of a methodological and conceptual framework that actually can capture that. It might be sort of a doctor running a hospital in Malawi who's actually refusing the gift of worn-out garbage hospital equipment that they are sending him because this is not what he needs. Or when he's screaming back and said, I do not want these 14-year-olds. Could these donors stop sending me 14-year-olds? And 14-year-olds are new management NGO, professional NGO people telling him how to run his hospital. So I think there is little acts like this every day. But one of the things that, since I went into the global health, that really annoys me is that the distance between the global policies that are made and crafted to the people that it's meant to serve is just enormous. And when we talk about this to Norwegian kind of development aid people, they jaw drops. They don't know a thing of what is going on. And I think that is really the disturbing part. So we really need, in a sense, to get studies together, conceptual clarity and all that, but actually can capture what is going on out there at the ground, in health system, in environments, and in. So I still think that, yes, we go for practices to see actually what kind of resistance and action there is out there. Thanks.
Well, thank you very much. I would just add that I think the difference is that the Mont-Pelerin Society and all of that was a project and it was strategic. So it's all of these little actions, but they have to be in a strategy. So let's give everybody a wonderful